All right, guys. Excuse me, bear with me. I'm starting to lose my voice a little bit this morning. Okay, now it is time for chapter 17, phlebotomy. Yay! This is another one of my favorites. Okay, so I know I say this all the time, and you guys are going to get sick and tired of hearing it, but again, read the entire chapter. Become familiar with all the tables, the procedures, and the figure pictures on this one, on the chapters as well. I'm going to hit on the basics of the stuff that you need to highlight. Okay, so let's start on page 618, the introduction to phlebotomy. Highlight that phlebotomy is defined in general as a collection of blood. An individual who collects a blood sample is known as a phlebotomist. Phlebotomy encompasses three major areas of blood collection: arterial puncture, venipuncture, and skin puncture. If we look for venipuncture means that the puncturing of the vein for the removal of the venous blood sample. The methods are by a vacuum tube method, a butterfly method. The vacuum tube method is the fastest and the most convenient method and is used most often. This method relies on the use of an excavated tube, which is a closed glass or plastic tube that contains a vacuum. The butterfly method is used for difficult draws, such as when a vein is small or has sclerosed, hardened. This chapter presents the theory and procedure for both of these methods. Let's look under the patient preparation for a venipuncture. The patient should be given instructions an appropriate number of days before the specimen collection on any advanced preparation that is required. That needs to be highlighted. For the review collection handling requirements, you need to highlight where it says, if the specimen is transported to an outside laboratory, this information is indicated in the laboratory directory or the laboratory website. Figure 17.2 shows an example of the collection and handling requirements for a complete blood count, known as a CBC, that is presented in a laboratory directory. In the identification of the patient, you need to highlight where it says, after greeting the patient, the medical assistant should ask the patient to state his or her full name and date of birth. This information should be compared with the demographic data indicated in the patient's medical record. On page 620, under the assemble the equipment and supplies, you need to highlight that substituting blood tubes may not yield the proper type of specimen required or may affect the test results, as shown by the following examples. Highlight that a medical assistant should check each blood tube before use to ensure that it is not broken, chipped, cracked, or otherwise damaged. The medical assistant should make sure to check the expiration date on the tube to avoid using an outdated blood tube. The medical assistant must be sure to label each blood tube. 2 unique identifiers should be used to label the specimen. That needs to be highlighted. For the reassuring of the patient, I need you to highlight in the second paragraph where it says, never tell the patient that the venipuncture will not hurt. Just before inserting the needle, tell the patient that he or she will feel a small stick. On patient position for venipuncture, highlight on the second paragraph where the patient should be seated comfortably in a chair. In the third paragraph, you need to highlight that the patient may faint or injure himself or herself. If the patient appears nervous or has fainted in the past from a venipuncture, it is best to place the patient in the semi-reclining position, also the semi-Fowler position, on the examining table. If we go on over to page 622, please highlight where it says, although unusual, it is possible for the blood to flow from the evacuated tube back into the patient's vein during the procedure. This condition is known as the venous reflux. Also highlight where it says the venous reflux is prevented by keeping the patient's arm in a downward position so that the evacuated tube remains below the venipuncture site and feels from the bottom up. Application of the tourniquet. Highlight that the tourniquet makes the patient's veins stand out so they are easier to palpate. The tourniquet acts as a dam that causes the venous blood to slow down and pool in the veins in front of the tourniquet. This pulling of the blood makes the veins more prominent so that they are more visible and can be palpated. Also highlight that a tourniquet that is too tight obstructs both venous blood flow and arterial flow, which may result in a specimen that produces inaccurate test results. For guidelines for applying the tourniquet, please highlight number 2, 3, 4, 5, 6, 7, and 8. On number 2, where it says place the tourniquet 3 to 4 inches above the bend of the elbow. So above here, so 1, 2, 3. So usually in this area of the arm. For number 3, apply the tourniquet so it is snug but not too tight that it pinches the patient's skin or is otherwise painful to the patient. When applying the tourniquet for number 4, ask the patient to clench his or her fist. Number 5, never leave the tourniquet on longer than 1 minute. On number 6, you should remove the tourniquet as soon as a good blood flow is established. On number 7, always remove the tourniquet before removing the needle from the patient's arm. Highlight that where it says resulting in a hematoma. A hematoma is defined as a swelling or mass of coagulated blood caused by a break in the blood vessel. On number 8, after use, wipe a tourniquet thoroughly with a disinfectant such as alcohol. For a rubber tourniquet, you need to highlight the rubber tourniquet consists of a flat, soft band or rubber approximately 1 inch long. Rubber tourniquets are commercially available in latex and non-latex rubber. They offer the advantage of being easily removable with one hand. The technique for applying a rubber tourniquet is described next as an illustrated in figure 17.6. Please read the procedure 1, 2, 3, and then the figure 17.6. If we go on over to page 624, please become familiar with figures 17.7 and 17.8. And for the site selection for the venipuncture on the other side on page 624, you need to highlight where it says the best vein to use in the antecubital space is the median cubital. That needs to be highlighted. On page 625, above guidelines for site selection, you need to highlight where it says, in contrast to a vein, an artery pulsates and more elastic and has a thicker wall than a vein. If the brachial artery is inadvertently punctured, the patient feels more than the usual amount of pain. And if the blood is bright red and comes out in pulsating movements, if this situation occurs, the tourniquet should be removed and then the needle. Pressure with a gauze pad should be applied for 4 to 5 minutes. For the guidelines on site section, please highlight number 2 where it says ensure that the veins stand out as much as possible. On number 3, highlight examine the antecubital veins on both arms. On number 4, highlight that a vein does not have to be seen to be a good section. I will always tell you guys this, and when we actually are able to do the venipunctures, is to go by feel, not by sight. On number 5, highlight that it usually is bigger and anchored better, bruises less, and poses a smallest risk of injuring underlying structures. On number 6, you need to highlight that place 1 or 2 fingertips, index and middle fingers, over it and press lightly and then release pressure. So, let's see, so like you'll just kind of release and you'll be able to kind of feel like almost like a rubber type feeling. It's a unique feeling, and you should be able to do it, but we'll go over it in class. Do not use your thumb to palpate the vein because it is not as sensitive as the index finger. On number 8, you need to highlight map the location and skin marks. And number 9, do not leave the tourniquet on longer than 1 minute. On number 10, you need to highlight each of those bullet points. For the alternative venipuncture sites, if it is possible to locate a suitable vein in the antecubital space, alternate sites are available, including the inner forearm, So it would be the inner forearm, the wrist above the thumb, and the back of the hand. Also highlight on the next paragraph where it says the veins of the hand have a tendency to roll because they are not supported by much tissue and are close to the surface of the skin. This makes them more difficult to stick. In addition, an abundant supply of nerves is present in the hands, which makes this procedure more uncomfortable for the patient. Hand veins tend to have thin walls, which makes them more susceptible to collapsing, bruising, and phlebitis. Types of blood specimen. You need to highlight number 1 for the clotted blood, number 2, the serum, number 3, the whole blood. Also become familiar with figure 17.10. And number 4, plasma, as well as the top layer, middle layer, and bottom layer. For the OSHA safety precautions, please highlight number 10 and 11. If we go on over to the needle, please become familiar with figure 17.12. And on the third paragraph under needle, I want you to highlight that the vacuum tube needles are available in sizes 20 gauge to 22 gauge, with the 21 gauge needles used most often for routine venipuncture. If we go on over to page 629 under figure 17.13, highlight where it says evacuated tubes are available in varying capacities that range from 2 milliliter to 10 milliliter. See figure 17.14. The capacity of the tube depends on the amount of the specimen required for the test. On page 630, please become familiar with figure 17.14, 17.15, and 17.16. I also want you to highlight 1, 2, 3, 4, 5, 6, and 7 for the additive content of the evacuated tubes on page 630 and 631. If we look at the evacuated tube guidelines, I need you to highlight number 3. Please become familiar on page 632 on figure 17.1. And then on page 633 for number 11, highlight that where it says mix tubes that contain a clot activator or an anticoagulant immediately after drawing by gently inverting them. Gentle inversion provides an adequate mixing without causing hemolysis or breakdown of the blood cells. Please become familiar with procedure 17.1 on page 633, 634, 635, 636, 637, 638 as well. But I want you to highlight on page 637 the procedural step 24. On page 639, if we look at the butterfly method of venipuncture, please highlight that first sentence where it says the butterfly method of venipuncture is also called the winged infusion method. On the other side on page 639, please highlight where it says the gauge of the winged infusion needle used to collect a blood specimen ranges from 21 gauge to 23 gauge, and the length of the needle ranges from 1/2 inch to 3/4 of an inch. On page 640, please highlight number 3, 4, and 5 on the guidelines for the butterfly method. On number 3, a 15-degree angle to the skin. When the vein has been entered, decrease the angle to 5 degrees. On number 4, after decreasing the needle angle to 5 degrees, slowly thread the needle inside the vein an additional 1/4 inch or 1/4 inch. On number 5, to prevent venous reflux, keep the evacuated tube and holder in a downward position as in the vacuum tube venipuncture procedure. Please become familiar with with figure 17.19, 17.20, and procedure 17.2 on page 641, 642, 643, 644, 645, and 646. On page 646, under failure to obtain blood, please highlight where it says periodically even individuals highly skilled at performing venipuncture have difficulty obtaining blood. That needs to be highlighted. If we go on over to the other side on page 646, above inappropriate puncture sites, please highlight that recommend removing the needle rather than trying to probe the vein. Probing is often uncomfortable for the patient and can affect the integrity of the blood specimen, leading to inaccurate test results. For inappropriate puncture sites, please highlight the following. In addition, any skin areas that are scarred, bruised, burned, or adjacent to areas of infection should not be used. A venipuncture should not be performed on an arm with edema or an arm on the same side as a mastectomy. Highlight that other sites to avoid include an arm that has a cast applied to it and an arm on the same side as a radical mastectomy. For scarred and sclerosed veins, please highlight that the veins feel stiff and hard when palpated. Please become familiar with A, B, C, D, and E on figure 17.21. If we go for the rolling veins, please highlight the very last sentence. To prevent rolling, firm pressure should be applied below and to the side of the vein to stabilize it as the needle is inserted. For collapsing veins, highlight that veins are most likely to collapse in individuals who have small veins. Also highlight the very last sentence. Because better control and less pressure on the vein are possible, the butterfly method of venipuncture is recommended to obtain the specimen in patients with small veins. On page 648, please highlight above hematoma where it says blood may be forced out of the puncture sites. On hematoma, please highlight that a hematoma is caused by blood leaking from the puncture site of the vein and into the surrounding tissues, resulting in a bruise. Highlight that insufficient pressure applied to the puncture site after the removal of the needle. The first sign of a hematoma is a sudden swelling around the puncture site. If this occurs when the needle is in the patient's vein, first the tourniquet and then needle should be removed immediately, and the pressure should be applied to the puncture site until the bleeding stops. For the hemolysis, highlight that hemolyzed blood specimens produce inaccurate test results. Also highlight on number 3, using a small gauge needle, for example, a 25 gauge, can cause the blood cells to rupture as they pass through the lumen of the needle. For fainting, you need to highlight where it says the most immediate concern is to protect the patient from injury. For obtaining a serum specimen, for the serum, please highlight where it says serum contains many dissolved substances such as glucose, cholesterol, sodium, potassium, chloride, antibodies, hormones, and enzymes. For the tube selection, please highlight the following. Because the amount of serum recovered is only a portion of the specimen, a blood specimen must be drawn that is 2.5 times the amount required for the test. If 2 milliliters of the serum is required, a 5 milliliter tube of the blood must be collected. If 3 milliliter of serum is required, an 8 milliliter tube of blood is collected. If a 4 milliliter of serum is required, a 10 milliliter tube of blood is collected. For the preparation of the specimen, please highlight after the blood specimen has been collected. The red stoppered tube, or SST, must be allowed to stand upright at room temperature for 30 to 45 minutes before being centrifuged. Also highlight where it says the result of this is a formation of fibrin clot in the serum layer. The fibrin clot is a spongy substance that occupies space, interfering with adequate serum collection, as seen in figure point 22. Please become familiar with that. For the removal of serum, highlight where it says the specimen is centrifuged for 10 minutes. For serum separator tubes, highlight red-gray stopper. If you will become familiar with procedure 17.3, if we go on over to page 653, please highlight under skin puncture where it says a skin puncture is used to obtain a capillary blood specimen and is also called capillary puncture. For the puncture sites, The puncture site varies depending on the age of the patient. The fingertip of the third or fourth finger is the preferred site for a skin puncture in an adult. That needs to be highlighted. Highlight in an infant birth to 1 year old, the skin puncture should be performed at the plantar surface of the heel. Highlight after a child has begun to walk, the skin puncture can be performed on the fingertip. Under the skin puncture devices, highlight regardless of the skin puncture device, the puncture must not penetrate deeper than 1.3 milliliters in adults and 2.0 milliliters in infants, plantar surface of the heel, and children. If the puncture is deeper than this, the bone may be penetrated. That needs to be highlighted. Become familiar with figures 17.24 and 17.25. If we go on over to page 656, please highlight on number 10. Wipe away the first drop of blood with a gauze pad. The first drop of blood is diluted with alcohol. Highlight number 11 where it says, do not squeeze or massage excessively because doing so causes dilution of the blood specimen with tissue fluids, which can affect an accuracy of the test results. Please become familiar with figure 17.26. Also read over procedure 17.4, and then as well also become familiar with the terminology review for chapter 17.